Cardiac catheterization. Heart specialists, known as cardiologists, use cardiac catheterization to diagnose and treat a variety of heart conditions. To help you understand this procedure, let's first look at how a normal heart works. Your heart is responsible for delivering blood to all parts of the body. Veins carry oxygen-poor blood from your body to your heart. Arteries carry oxygen-rich blood away from your heart to nourish your body. The heart is actually two pumps, side by side, that work together to distribute blood throughout your body. The right side pumps blood on a short trip to the lungs to receive oxygen, while the left side delivers oxygenated blood throughout the body. Each side of your heart has two compartments, or chambers. The top chambers are the atria. The bottom ones are the ventricles. Special valves keep blood flowing from one chamber to the other without moving backwards, like one-way gates. When the valves open and close, they make a distinct sound that can be heard with a stethoscope. The rhythm of the heart is very organized and controlled by a built-in electrical system. Usually, your heart rate is regular and beats between 60 and 100 times per minute. When you rest or sleep, it beats more slowly. When you are active, it beats more quickly. Special pacemaker cells located in the upper right-hand corner of your heart control all of this. Like any other muscle in the body, the heart muscle requires a blood supply of its own in order to work properly. The heart may not function well if there are any problems with the valves, electrical system, or its own blood supply. If you have chest pain, heart failure, valve disease, a heart birth defect, or other heart trouble, your healthcare provider may recommend that you have a cardiac or heart catheterization. This procedure refers to a series of tests used to find out how well your heart is working. The tests use different catheters with special tips or sensors. During the procedure, your cardiologist may also measure the blood pressure within your heart, lungs, and blood vessels, and evaluate how well your heart pumps. The amount of blood flowing through your heart and blood vessels, as well as the level of oxygen in your blood, may also be checked. Rarely, a tiny sample of heart tissue, a biopsy, can be removed and tested. Specialized catheters may even be used to treat heart or valve disease during the test. Even though the doctors are studying your heart, all of the activity takes place through your leg. It is therefore much simpler than surgery, and you do not need to be asleep for the procedure. In fact, during the test, you may be asked to follow directions such as raise your arm, hold your breath, or cough. Cardiac catheterization, the procedure. To prepare for the procedure, you may be told to shower the night before the test and not to eat or drink anything, including water, after midnight. Your healthcare provider will instruct you on whether to take your medications with sips of water. Procedures may vary slightly among catheterization laboratories or cath labs. The cath lab looks similar to an operating room. Your leg will be cleaned and then shaved if needed. Sterile drapes will be placed around you to decrease risk of infection. ECG electrodes will be placed on your chest, and a blood pressure cuff will be put on your arm. To help you relax, medicine is given through a vein in your arm. However, you will remain awake for the procedure. The skin on your leg will be numbed with an injection of lidocaine. Using a needle, a short plastic tube or sheath is placed into a blood vessel in your leg. The needle is removed, but the sheath is left in place. It is through this sheath that a long, thin, flexible tube or catheter is inserted into the blood vessel and guided into your heart. A guide wire helps your cardiologist thread the catheter through the blood vessel. Different catheters with specialized tips can be inserted and removed through the sheath to perform various heart catheterization procedures. A view screen shows X-ray pictures of the catheter's progress to the heart. While watching the screen, the cardiologist will position the catheter in various parts of the heart to get specific information needed and to do contrast studies with dye. During the test, you may notice cameras rotating around you to get pictures of many different angles. Even the table you are lying on may tilt from side to side, and you may be strapped to the table for your safety. During your heart catheterization, you may experience various symptoms. A warm flushing sensation when dye is injected. Your heart beating faster or slower, or skipping a beat. Brief episodes of nausea. You may feel pressure when catheters are inserted and removed. However, this should not be painful. Since you will be awake, tell your healthcare team what you are feeling during the procedure. Tell them immediately if you experience chest pain. Coronary angiogram. One of the most common tests done during a heart catheterization is a coronary angiogram. This test takes X-ray pictures of the arteries that supply blood to your heart. A contrast dye is injected into the catheter to reveal whether blood vessels are blocked. The next step. Your cardiologist will discuss your cardiac catheterization results with you. Depending on what the pictures show, there may be 3 options to treat your heart problem: a change in medicines, bypass surgery, or a percutaneous transluminal coronary angioplasty, or PTCA. Angioplasty may be advised if the test finds a narrowing or blockage of one of the vessels that supplies blood to your heart. It can be done right then in the cath lab or at a future date. During an angioplasty, a specialized catheter with an inflatable balloon is inserted through the opening near your groin and advanced to the area where the blood vessel is narrowed or blocked. The balloon is then inflated to open up the blockage. A blood-thinning medicine may be given to help prevent a blood clot from forming. In most cases, a metal stent or a small stainless steel wire mesh tube is placed inside the blood vessel to support its walls. Cardiac catheterization. Aftercare. When the procedure is over, pressure will be applied to the puncture site for at least 15 minutes. You should lie still for up to 6 hours. It is important to let the artery in your leg heal completely. Watch for bleeding, bulging of skin, coolness, or tingling in your leg. It is important to avoid prolonged periods of sitting or walking for at least 24 hours after the test. Most that have only a cardiac catheterization procedure go home the same day. If additional therapy is required, then you may need to stay in the hospital overnight. Cardiac catheterization, benefits and risks. Cardiac catheterization gives your healthcare provider information that other tests, such as an ECG or blood test, may be unable to provide. It is a relatively safe procedure and serious complications are rare. Your healthcare provider will discuss the benefits and risks of the procedure with you. The following are possible complications that can occur. A small bruise or a bulge at the site of entry is common. Infection at the puncture site, however, is infrequent. Irritation of nearby nerves, but this is usually temporary. An allergic reaction to contrast dye is also uncommon. Serious complications such as irregular heart rhythms, heart attack, blood clots, stroke, trauma to the blood vessel, and kidney damage are rare. What to do? Tell your healthcare team immediately if you feel any chest pain or discomfort during the procedure. To help remove the contrast dye from your system, drink fluids as directed by your healthcare team after the test. After the test, follow all the instructions of your healthcare team. Notify your healthcare provider if you have allergies to iodine material or shellfish. Tell your healthcare provider if you are pregnant. This test is not recommended during pregnancy. Arrange for a ride home if you do not need to stay in the hospital overnight. You are not usually allowed to drive the same day of the procedure. When to call your healthcare provider. Call if you have increased pain or discomfort. Call if you notice bleeding or bulging of skin at the catheter site. Call if you have signs of infection such as redness, warmth, drainage, or fever. Call if you experience coolness or tingling in your leg. Call 911 if you have difficulty breathing, develop severe chest pain, or experience symptoms of stroke, such as confusion, slurred speech, drooping on one side of your face, decreased movement or sensation on one side of your body. What we have learned. Cardiac catheterization can diagnose and treat a variety of heart conditions. True or false? The answer is true. A coronary angiogram is a test that takes X-rays of the arteries that supply blood to the heart. True or false? The answer is true. Heart attacks, stroke, and other serious complications resulting from heart catheterization are rare. True or false? The answer is true.